When I think about forward and moving forward, the only way that we can move forward is with community. And we need to always recognize that us here in the wonderful academic scenario are really only part, a small part, but an important part of the solution. The real solution comes from the community. We got to connect with folks. We got to respect the leaders that are there. We need to learn from them and walk with them. And when we do that, I think we have a hope of making a difference. One of those leaders is going to be speaking next. That is Fernando Rejon. And Fernando Rejon is the executive director of the Urban Peace Initiative. This Urban Peace Initiative is a violence prevention institution that serves communities throughout the country, helping to address community needs, efforts to receive resources to help them mobilize, working to address various different forms of violence, including the gun violence prevention efforts, and helping to make a difference by bringing community and the voice of community and the efforts of community to the forefront. So I'm very happy that we are so fortunate to have Fernando here with us to share a few words. Please welcome Fernando.
All right, so thank you. It's really an honor to be here with my esteemed panelists. It's always good to give shout outs, I've learned. But I want to give shout outs to a couple people here that I know. So Saul Garcia, he's a recent graduate of the MPH program here at UCLA, and he works for Urban Peace Institute, coalition organizer. Where's he at? There he is, right there. And then we have a great partnership with the Department of Public Health. We get fellows every year, free of charge, which is great. And they do amazing work. We've had two so far. Holly Calhoun, I don't think she's in the audience somewhere. Recent UPI fellow alumni. It's an honor to be here. You know, this is, for me, this isn't really a career, this is really my life journey. And, you know, as I was listening to Dr. Prothero-Stith talking about some of her experiences with the young man, right? You kind of go through life and you talk to people who kind of plant seeds in your mind about why, and it shapes how you do this work. So this one time I was in a parenting class, you know, supporting the class. I wasn't teaching the class, I didn't have any kids, but I was in the class and there was a young man there. And so a lot of times you can see all gang involved individuals. And a lot of times you can see when someone walks into the room, they have something on their mind, something on their heart. They want to get off. They're fidgeting, they're nervous a little bit, maybe sweating. And, you know, we were able to create a space where people could speak freely. And it took him a while. We were having the conversation. We were prodding him a little bit because we knew he had to get something off his chest. And what he shared was that, you know, he's trying to be a good father. And he picked up his son from school, had his son in the back in the car seat. And then he saw some of his enemies. He pulled out a gun and shot at him from the car. And then he asked the question, does that make me a bad father, right? And, you know, in my mind, I'm like, whoa, right? But the first rule when you're working with the population is you don't judge, right? There's no judgment. That's a world a lot of times that if you're not immersed in it is that you don't understand. So you have to take those questions seriously. You really have to understand the reality and how in that kind of invisible world to a lot of people, how that could transpire and what that means. And so for me, that, you know, that was one of the many moments I think that I've had where this is what we're dealing with and how are we dealing with it. In 2014, it was the lowest rate nationally of violence in the country, right, since they were keeping records of, if you read the book Uneasy Peace, and they're asking, why was that, right? The homicide, I think the city of LA had 249 homicides that year, which is 249 too many. But that was the lowest we've seen in decades. And nationally, it was a trend. And they were looking at, medical technology, ambulances. They were looking at, responses, looking at everything. And what they said is that what they haven't really been able to evaluate yet is community agency, right? The agency of community leaders in reducing violence. And to me, that's a very important issue, and it's something that we work on. So currently in LA, if you've been reading the LA Times, or if you're hearing anything that's going on, the last 7 days, so from Sunday to Sunday, 26 shootings, 10 homicides. So we're seeing a surge. Rest in peace, Nipsey Hussle, but also all the other men and women who were shot or actually died from homicides, right? We're seeing this surge in violence, and Monday morning we had a meeting where we got together the peacemakers, the gang intervention workers from throughout the city, and we were having conversations about, okay, what does it feel like to you? And if you're in this work long enough, you get a feel for, it's going to be a hot summer, we're going to start to see violence go up. And I was talking briefly to Dr. Shepard earlier today, and I said, are you seeing some of it? And he said, yeah, right? But at some point you get a sense, like a sixth sense of like, okay, it's going to be a hot summer. What are we going to do as a city, as leaders in communities, as a county to address this proactively, and what strategies are there? So I want to talk a little bit about that. Right now, we are in LA, there's 221 people shot. That's a rise of 9.4% compared to this time last year, and 60 homicides. Last year we were at 66 at this time. So we're starting to see it go up, and a lot of times an indicator of how violent a community is really the numbers of shootings, right? If there's a lot of shootings going on in a community, some people are missing, some people aren't killing them, but it generates a high level of violence, but also a high level of trauma, which a lot of times we don't understand. We don't take into account the impacts of trauma, right? Of recurring trauma, compounding trauma. I'll get to, we released a report in 2007 where we found that the trauma rates in South LA were similar to war veterans coming home, or people coming home from the war zones in Iraq, right? And that raised a lot of hair on people's back, like, whoa, what are you talking about? But also, too, is that those veterans left the war, right? They're not in the war zone anymore, but they do bring back the trauma. But also, when you have kids living in these war zones, there's recurring and compounding trauma that leads to toxic stress, that leads to a whole series of issues that I'm sure you all are aware of. So I wanted to make that point. The other point is that when we talk about mass shootings and the tragedies that have happened, there's also a number of shootings every day in invisible LA, invisible Oakland, invisible Chicago, invisible New York that account to a mass shooting every day. So we have to look at the cumulative impacts of the shootings, not only the people who got shot, their families, and then the communities that have to navigate the war zones. And so this is a map. And this is Watts, and these have changed, but these are different neighborhoods in the Watts community. And this could be any community where there's a high saturation of gangs. And I show this, and I always ask is, how do you address the violence here, right? So this is invisible Watts. There's county lines in there, there's city lines, there's even kind of different kind of communities, but then this is a map that the kids have to traverse to go to school. They have to know the boundaries, they have to know where they're at all times. How do you begin to unpack this, right? But in here, not everyone is violent. Majority of people are not violent in these communities, right? But if there's a prevalence of guns, the economic situation is low. The primary prevention infrastructure isn't strong. Secondary is not strong. Mass incarceration might be strong, right? When you have law enforcement come in. How do we begin to address these issues? So, wrong button. So again, we released a report in 2007. It was an audit of the 30-year war on gangs. What we found in the city and county of LA is that while gang violence was spiking up and down, there was also the highest number of gang membership that there had been in the city and county of LA. And that 1,000-page report weighs like 12 pounds. It basically said, hey, look, we need to do something different. LA is stuck on stupid. We've wasted millions of dollars on gang prevention, but we're still seeing high numbers of gang membership, but also high rates of violence. And this report consolidated $24 million into the mayor's office to protect it from council members that might want to divide by 15, and targeted it in the highest need areas, right? The most violence impacted areas using Part 1 crime statistics. Public health approach. I'm very careful not to say public health model. I say public health approach because we augmented a little bit. We learned a lot from Gary Slutkin. We learned a lot from Dr. Prothero-Stith, what they did in Boston, and we really researched that. And so the premise is, and this is the perfect audience, is violence is preventable and treatable, right? How many people believe that? Okay, so it's not just endemic to people of color, right? Wow, all right, that's a realization, all right. So 23 grid zones now throughout the city of LA, most impacted areas, $1.2 million invested in each of those areas, about $800,000 in prevention and $500,000 into gang intervention, targeted into these areas where they have the highest need. The budget is about now $30 million. It's one of the largest budgets that are invested to address violence in the country. Chicago has a good amount of investment as well. I think they're up to about 28, 30 million as well. I won't go through all this stuff, but what we talk about is to address the root conditions of violence, gang intervention, street outreach, prevention services, re-entry and transitional services, relationship-based policing. Relationship-based policing is different than community policing because you're forcing officers to work with people that don't like you. It's easy to work with the ones that want you there and open the door for you, want to have coffee with you, but you have to build relationships with the people that don't like you, the people that are scared of you. And then smart justice. And smart justice is, how are we reforming the criminal justice system to end the pipeline into prison and open up gateways to be out? I was talking to a foundation leader last week, and he said, as a black man, he said, being out of prison is just not being in jail or not being in prison is not enough. That's not justice to me. As we close the pipelines to the prison system and people get released, where justice comes is the investment in changing the social conditions that created those pipelines, right? And so as we're addressing gun violence, we have to understand, one is why it manifests and what leads to it. I'm going to talk briefly about Chicago. Chicago right now on the streets, we do a lot of work out there, training with all the peacemakers on the south side and west side. They have a 399 movement. Their goal this year is to get to below 399 homicides. That's their goal. And they're talking about it on the streets. And when they achieve it, they're going to celebrate. But then what's the next level? In the city of LA, we've had less than 300 homicides for the last 10 years, which is significant, but it's still 300 too many. I think in the city of LA, we've hit a plateau. Once you hit that plateau, what's next? We need to be able to get to zero gang-related homicides. But also, we need to start investing in changing the economic conditions in these communities. Back to Chicago, one of the reasons the levels of violence are so high is, many people say Indiana, of course, because the gun laws are so lax over there. You go right across the border, the state border, get your guns and come back. But also, they have access to banana clips, they have access to automatic weapons, right? And there's a difference. There was an article that came out in the LA Times where they talked about mass shootings, and they looked at mass shootings when they use automatic weapons versus when they use handguns. And there was a difference in the level of carnage and level of lethality. In Chicago, very similar. Because there is a higher level of lethality or access to larger magazines as well as high-powered weapons, there's more carnage because you have more people hit, right? And so as we're addressing gun violence and we're looking at the impacts of gun violence, there's an argument to be made around gun control, and now gun control starting to invest in addressing community violence, but also investment and increasing the agency of community leaders in the community to address violence in a different way. So with that, I'll end there. So thank you very much.